First guest is Dr. Timothy Mims with comprehensive pain specialist, and you are an interventional pain physician.
That is correct.
Yeah. Now, when we talk about pain, everybody thinks about, it's been in the news, pain medicine. Well, tell us about the pros and the cons and other things we can do.
Well, I'm glad you're having me here today, Dr. Fox. What's really important is that, as we know, there's a big epidemic going on nationwide, but in particular in Kentucky, the opioid overdose rates is ranked number 3 in the nation, and there's been over 165,000 deaths since 1999, and these rates have quadrupled over that time. And so, what I'm glad to be here to try to relate to the public and tell them that there are other treatment options out there.
But there are times when pain medicines are needed, when used appropriately, that they can be helped.
Oh, absolutely. Opioids do have a role in pain management. I believe that few people can benefit from it, but most patients can also benefit from utilizing other alternative therapies as well.
Well, tell us about some of the alternative therapies to help with pain.
Well, we want to focus more on utilizing therapies to help address the cause of pain. So it's very important to assess the patients very carefully, take a thorough history, physical examination, and try to get to the root cause of pain. And there are many, many, many causes. Once we do that, we can go ahead and implement some interventional therapies, a lot of injection therapies, nerve blocks, radiofrequency ablations, where we can actually deactivate some of those nerves for quite a long period of time to help address and relieve some of these patients' discomfort.
And those are all things that don't involve narcotics or pain medicines, but interventions which may actually treat the problem that's causing the pain.
Oh, absolutely. There are numerous FDA-approved, cost-effective, evidence-based, non-pharmacologic treatments in our arsenal that we can utilize to help chronic pain.
Well, when you say chronic pain, what are some typical things that you see that you use an intervention on? For us, one of the things we see is back pain and arthritis, but I'm assuming you see a lot of things that cause pain.
Oh, absolutely. There are over 100 million Americans suffering from chronic low back pain, headaches, osteoarthritis, and we can treat all those with interventional therapies. For example, patients who have degenerative disc disease, maybe some sciatica, some arthritis of the spine, we can implement a lot of these modalities to isolate the pain source or cause and try to help alleviate those symptoms without utilizing pain medications.
Well, you mentioned interventions you talked about and pain medications, but are there some other types of medicines you can use that are not narcotic?
Oh, absolutely. We can use anti-inflammatories, muscle relaxants, membrane stabilizers. What those are, typically Neurontin or gabapentin or Lyrica. Those have a tendency to help certain types of pain, in particular pain associated with nerve damage. We see a lot of that in diabetic peripheral neuropathy or peripheral vascular disease.
Well, that's great information from Dr. Timothy Mims, an interventional pain specialist.